Good afternoon and welcome to our OakBend Medical Center Happy Hour podcast. My name is Donna and I am your host. Today we have a very special guest who will be speaking about respiratory health. Christy Boerger is the Cardiopulmonary Manager at OakBend Medical Center. She's been employed with OakBend Medical Center since 2004. She has been active in their community outreach program and presently serves as a development board member. Christy also participates with the College of American Pathology of Lab Inspectors for area hospitals and a member of the American Association for Respiratory Care and Texas Society of Respiratory Care. She was also yesterday voted by her peers in the hospital for one of what we call the STARS Award. These are for outstanding employees that are recognized amongst their peers to be leaders and to be very active in the organization. Christy, we welcome you and congratulations.
Yay! Thank you. I was so blindsided by that award yesterday, so it really took me off guard, and it was really exciting though to see the recognition. All the hard work has paid off, and just being recognized of what you do and what, going above and beyond. So thank you. And thank you to everybody that, voted. So that was nice.
Christy and her team are very passionate about respiratory health. And for those that don't know what her team does, they do all the codes in the hospital. They manage the vents. They do all things respiratory. So they've had their hands full and they've been challenged. But they've always done it with a smile and understanding the patient's needs, and that is to be commended.
And I think that when you are coming into the hospital with a respiratory related issue, you're already overwhelmed, you're scared, and you need that friendly smile coming in saying, you know what, you're going to be okay. We're going to get you to breathe. And I think within the healthcare system, you need people that are going to come in and shine and make you feel better. So I'm glad that I have a team that can do that and stuck with me through these trying times, because these last 2 years have been brutal.
Yes, they have, both emotionally, physically, yes, and everything else. And thank you to you and your team and your families.
Thank you.
Because understand, when our guys are in the hospital working 12-hour shifts plus, and then sleeping when they're home, their families also are involved in it. So we thank them also, because they are also our heroes.
That's right.
But we start reading things about vaping. People don't smoke, don't do this, but here's the alternative is vaping. There's a lot of controversy about it. So from someone in your expertise, what is vaping exactly?
So, this was probably introduced in the early 2000s. It's really popular amongst the youth, especially our teens, high schools, young adults. But this is an electronic cigarette that heats up liquid to create a vapor that you inhale. These are also known as like e-pens or e-cigs or e-hookahs. Vape pens usually is what I hear is vape pens. And these are so easy to hide. They look like these little USBs. So passing them around at school, you wouldn't think otherwise, but it's just this electronic device that creates this vapor and people are hooked, just like cigarettes.
Okay. And I understand there's other types of vaping and all kinds of stuff.
Yeah. So there's this liquid that goes into these vape pens that have these different effects. So, these e-juices are these cartridges that contain nicotine. And even when they claim to be nicotine free, there's still a little trace of nicotine in there. And then you have this THC, that's a compound of marijuana, which produces this high. You have the CBD oil. You have these flavorings, which again, really attract the youth. So you have this watermelon, mango, mint, cotton candy. When you're walking, outside, for me, I smell that scent and I'm like, cotton candy, where's the cotton candy? Oh, it's an e-pen, And so when you have those smells, those flavorings, that's what attracts the people to be like, to vape.
Okay. So is it dangerous to vape?
Talking about nicotine first, we already know that this is a really highly addictive chemical. And, it leads to slow development in teens. Nicotine can affect your memory, your concentration, your learning, your mood. And we mentioned earlier about the flavoring. So this chemical dye is called diacetyl. And in these flavorings, that's what's been causing the serious lung disease. So just like nicotine, it starts this inflammatory process. Your lungs become inflamed. And when that happens over a period of time, you start to create the scar tissue. And then your airway's already small. So on top of that, now you have this scar tissue, and that's just really hard to breathe. So that you'll see like increase in coughing because you can't get that air out. You have this lightheadedness because now on your exertion and walking, your body's not getting the oxygen it needs. And so you could feel a little bit of lightheadedness. You even could have chest pain because now you're exerting when you're walking from point A to point B, and you're working hard to breathe, you're huffing and puffing, your body's not getting the oxygen, now your heart's not getting the oxygen it needs. And so with all of that combined, just creates this respiratory issue, which in the long haul, it's like suffocating. You can't breathe. Just like cigarettes, vaping causes the same respiratory issues.
Okay, so it sounds like neither one's good for you.
Right. You don't want to do it. Stop now. Yeah, like we already know, nicotine is addictive. And, with these e-pods that you use, it gives you that feel-good sensation that nicotine produces, which we know it's short-lived. So once you smoke, you're already wanting your next one. You can see how this cycle could quickly get out of control and how that can lead to addiction. So it's same with vaping, you get that hit, you smoke that pod, and the next thing you know, it's like you're already ready to go outside. Or because now in the Houston area, you may have heard on the news recently that they've banned e-cigarettes in these public places. And so, now you've got to go outside, or you have to be so many feet away from a particular building, that takes you away from your family and all the fun. But going back to just the addictive part, then you have that THC, that's that compound of marijuana. So same thing, you're creating this high that you have to go back to. And so you can see how the cycle continues with this vaping. And it's just like cigarettes. You want more, you want more, you want more, you want more.
So with teenagers and everybody doing this, how would a parent or spouse or something recognize that their family members may be doing this if they're trying to conceal it? And are there any signs and symptoms?
So taking it back to teens, my daughter's school right now, vaping is so popular right now that they're giving this incentive to the students that if you catch a student vaping, you get $50. And so this is like big money to these teens, but they're hiding in the bathroom and they're smoking in the stalls. And so for the students and even for parents, and I guess you're surrounding your family members, it's the smell of the flavoring. So sometimes you don't have a smell, but most of the time these teens are getting a smell. So you smell that cotton candy. Also, it's just coughing. So just like cigarettes, you have that, you'll start noticing coughing all the time and like, man, what's going on with you? Why are you coughing? And you just may notice that just them walking around the house, just short of breath and just not being able to catch your breath. Like they just ran a mile. Like, did you just go running? So you notice things that just aren't typical, especially of your kid. And because this is such on a rise, like I mentioned earlier, it's really hard to know if these kids have vape pens because some of them look like these USB devices. And then you have social media that's really connecting to these kids. So let's say Snapchat, you have this high schooler that's saying, hey, I'm selling these pods for $1. And these kids are reaching out, and that story gets passed on to this person, to this person, this person. And then this high schooler, because some of the schools are all connected together, you can meet these kids at the junior high, or, the kids drop off the parents drop off their kids in front of the junior high. Well, they look like they're going into the junior high, but they stop and they turn and they walk towards the high school and they meet in the middle and then they get their pods. And so it's so easy now for these kids to be so discreet and not knowing. So it's pretty scary for us parents, and really being able just to talk to your kids and be open with your kids about, you know, the effect of what this does.
Right. In the long-term
Right.
damage of it.
Right. You know, I have to scare them. You're going to suffocate. You're going to suffocate to death. Who wants to live like that? Who wants to not be able to breathe? And so I think for me as a respiratory therapist, I'm really harsh on what, you know, what could happen. And so just being a push to others, like, if you're smoking, stop now.
If you do stop, can your lungs reheal?
Yes, and then a no. So like I kind of talked about this earlier, when you stop vaping, your nicotine level drops, which causes this unpleasant feeling, headaches, you're really moody, and you just want another cigarette. So you wouldn't be surprised that lung problems might develop from people who vape, just like you develop lung problems with cigarettes. You know, so our lungs are meant to inhale air and clean air at that. So it took many years for scientists to recognize the damage that cigarettes can cause. So we can only imagine that what that damage has done is being done the same for vaping. But you know what? Our bodies are amazing. If you stop now, you can begin the healing process. Your lungs may not be the same as they were pre-smoking, but your lung capacity can increase again. You might be able to walk that distance again. Yeah, you're going to cough a lot in the beginning. And that's really what detours people from stopping, is because now you're coughing, but you're coughing because your lungs are trying to get all that junk up. But people say, oh, but when I smoke, I stop coughing. So they want that cigarette again, or they want that vape pen again. But it's just that process of cleaning out your lungs. So if you can just get past that couple of months of cleaning out your lungs, you have the potential to reverse this. And but it's just going through some hard stages, which we know nicotine's addictive. So now you're also fighting that battle of addiction as well. And so it's like a hard year. But once you get past that, the benefits of breathing better and just living longer. But sometimes the damage has already been done. And so that's where we see the long-term effects of smoking and what we call that COPD, that chronic obstructive pulmonary disease, where people then, you know, have to go on oxygen because they can't walk from A to B. And so it just depends on how much you smoke, how often, how many years. But, you know, the best thing that you can do for you and your body and for your health is to stop smoking and stop vaping now.
And, you know, we had a podcast with Dr. Laddie, and he was talking about the lungs after COVID. So especially now with all those that have had COVID, it would not be wise to even smoke or vape, even more so.
Right. And that damage that's been done from COVID, you know, we're starting to see that effect, you know, and it was all, are we going to start seeing these patients again? But we're starting to see these patients come in that are post-COVID. And so, you know, it's scary for me to see somebody in that state post-COVID with the lung damage and they still are smoking or they're still vaping and just causing, you know, the severe damage of not being able to breathe. You want to breathe.
Yes, this is true. Yeah. It's a good thing.
I know.
So I have a question. I've heard this phrase before, and I really want to understand what it is. What is popcorn lung?
So a funny story, like going back in a couple of years, decades ago, they had this chemical. So I've talked about it earlier in the flavoring, in the vape pens, this diacetyl. So this diacetyl used to be in microwave popcorn for flavoring. And they noticed that these factory workers were getting sick, all from this popcorn factory. And come to find out, it was from this diacetyl. So now you don't have that anymore. Microwave popcorn is safe again. Continue to eat your popcorn. But at one point, this diacetyl was in your popcorn. Now you find it in the flavoring of these vape pens. So now we're seeing what we saw many, many years ago come back, and it all relates to this chemical, this diacetyl that was found back then. So it's just kind of this relationship of this finding many years ago. Not that your lungs look like popcorn, it's just that's when they noticed that this chemical causes lung disease and lung issues in this inflammatory process where your lungs, don't have that airway. Your smooth muscle is now, constricted where it can't get the air in and out. And also just being honest with your healthcare provider, letting them know that when you do go in and you see them that you are smoking, and that it is, you have that questionnaire, right? Do you smoke? And you've got to be honest and say, I'm not smoking cigarettes, but I'm vaping. It's the same. So being honest, in that, but that's where popcorn lung comes from. And it is a pulmonary disease. Yes, it is interesting, right?
You made some very valid points. We need to take care of our bodies. It's the only thing that we've got. We need to take care of our youth and be open and honest and let them come to us and talk to us about these things.
You're right.
Because they can be doing long-term damage. Anything else, Christy, you'd like to share with the audience before we go?
No, I mean, I think if you have any signs and symptoms of what I've kind of like discussed today about the coughing, the shortness of breath, and your vaping, please reach out to your healthcare provider. They can really help you in this smoking cessation of starting the process of quitting. And really, like you mentioned, Donna, what you can do now saves your body in the future. So stop smoking now, reach out to somebody who can help you and be the best you that you can be.
Christy, I thank you, your team, and all you do for this community to keep us as healthy as we can be. Thank you for being on the show. Would love you to come on again.
Yes, thank you. I appreciate it. Thanks for having me. And it's nice to get the subject out, and hopefully it reaches somebody and it touches somebody and they stop today.
I totally agree. So a big thank you to you, and a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on OakBend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.